Welcome, everybody. Hope this finds everybody well. Thank you for taking the time out of your busy schedule to join us live today. My name is Trent Morrow. I am the Georgia account manager with Microbiome Labs, and very excited for what we have ahead today with Dr. Sarah Ellis giving a presentation outlining the healthy gut, healthy hormones, understanding the gut microbiome as a neuroendocrine powerhouse. So this is a very important presentation, which is going to be addressing the role of the gut microbiome in regulating hormones and our endocrine system, which is, as we know, a key function of functional medicine that can often be overlooked. The complex community of microorganisms is involved in the production and metabolism of hormones, including estrogen, serotonin, insulin, and leptin. So the imbalance of the gut microbiome can often contribute to hormonal disruptions and have a significant impact on our health and dysbiosis. So to give you a little bit more information in relation to our outstanding speaker today, Dr. Sarah Ellis is a leading naturopathic physician and a clinical science liaison with Microbiome Labs and Novozymes One Health. Sarah holds a Doctor of Naturopathic Medicine degree from Bastyr University. As a naturopathic physician, she uses nutrition, nutraceutical supplementation, and lifestyle adjustments to help her patients become the best versions of themselves. She has a passion for women's health, gut health, nutrition, and family health. Sarah lives in Charleston, South Carolina, beautiful part of the world, with her husband and 2 children, and enjoys time reading and spending that precious time with the family. So thank you, Dr. Sarah, for joining us today, and we're looking forward to what you have to share with us.
Thank you so much, Trent. Hi, everyone. While we're waiting for folks to come on in, how about we hop in the chat and let us know where you're joining from. And as I pull up the slides, I am just going to provide a friendly reminder that all questions can go in the Q&A, and we'll have multiple points during the presentation where we'll check in and answer some questions. Hi, Susan from Raleigh, my Carolina neighbor. All right. We have our slides loading. Wonderful. And if someone can hop in the chat and let me know that you see my slides well as I place them in presentation mode. All right. Perfect. We can see. Okay, let's get started. So I'm so excited for today's presentation, a discussion on healthy gut and healthy hormones. And really, we want to focus on understanding the gut microbiome as a neuroendocrine powerhouse. We often tend to focus solely on our hormonal organs and even our liver when focusing on hormonal conditions and imbalances. But today we're going to learn how the gut microbiome plays a significant role in the metabolism and application of hormone balance restoration. Okay, there we go. So during our talk today, I'm going to give a brief overview of the endocrine system. I'll highlight some of the common causes of hormonal imbalance, and I'll be discussing the impact that gut dysbiosis has on endocrine function. Later on during the presentation, I'm going to provide specific insights on how the gut microbiome acts as a neuroendocrine powerhouse. Specifically, we'll look at the microbiome and the HPA axis, the microbiome and thyroid function, glucose regulation, and reproductive hormone regulation. Then I have a really awesome bonus. We are going to discuss a case together and walk through different Microbiome Labs products that we can implement to help support this mock patient. So the basics of the endocrine system, as you all know, the endocrine system is a complex network of glands and organs, and they work to secrete hormones, which are messenger chemicals, to control and coordinate a number of our bodily functions. They include growth and development, metabolism, sexual function and reproduction, and even mood. And as you know, the endocrine glands span really the entirety of our body. It includes major endocrine glands like the pineal gland, hypothalamus, and pituitary glands in our brain, the thyroid, thymus, adrenals, kidneys, pancreas, ovaries, uterus, testes, and even our gut microbiota. So, of course, we have to talk about common causes of endocrine disruption. We really would like to know what would cause our patients to experience endocrine disruption and hormonal imbalances. And some of those causes include genetic predisposition. As many of you know, we have patients that are genetically predisposed to a number of hormonal conditions simply based on family history. Then including infection, injury to the endocrine gland, which is common in traumatic brain injuries, a tumor of an endocrine gland, stress, exposure to toxins, liver dysfunction, a poor diet that's normally a standard American diet that's low in fiber and high in fat and sugar, obesity, and then the topic of today's talk, gut dysbiosis. Now, hormonal imbalances can present with a number of symptoms, stress or an inability to feel resilient towards stress, skin changes and hair changes like acne and hair thinning, difficulty sleeping, headaches, depression, and of course, changes to bowel habits like constipation and diarrhea. So let's start with talking about what constitutes a healthy microbiome. I'm sure you all have seen the schematic a number of times, but a healthy microbiome generally features increased microbial diversity, a low level of pathogens, a strong mucosal barrier, strong tight junctions along the intestinal cells, and an abundance of keystone species. Remember, keystone species, I consider them the sentinels of our microbiome, and they create an environment that encourages good bacteria to settle in and colonize and discourages the overabundance of pathogens. And most importantly, a healthy microbiome features increased production of short-chain fatty acids like butyrate and acetate. And these short-chain fatty acids also influence the production of hormones, like glucagon-like peptide 1 or GLP-1, ghrelin, and leptin. Other dysbiosis risk factors include infection, excessive alcohol use, smoking, stress, even medications and natural antimicrobials, a lack of sleep, intense exercise, the standard American diet, and toxins. So you may notice that a lot of the risk factors that can lead to gut dysbiosis are also implicated in the development of endocrine disruption and hormonal imbalances. Now, our GI tract is the largest endocrine organ in mammals and secretes dozens of different signaling molecules, including hormones and peptides. When the composition of the microbiome is altered by these different factors, which some can be good, some can be not so good. So smoking and intense exercise can lead to gut dysbiosis, whereas fiber-rich foods like kiwi can actually promote gut health and the production of short-chain fatty acids. So as we adjust and change the composition of the microbiome, it also changes the products and metabolites that is produced by our microbiome. And in addition, gut dysbiosis can change how much and how often hormones are produced and released. This schematic highlights the importance of certain factors on the microbiome. And as dysbiosis begins to set in the gut, it can cause leaky gut, which allows certain pathogens and toxins to pass through and into the gut lumen, where it activates the immune system and leads to the development of conditions and certain hormonal conditions that are also autoimmune conditions. So for example, we see here in the thyroid an autoimmune condition in the thyroid, which could either be Graves' disease or Hashimoto's thyroiditis. And the same can be seen in the pancreas as well, with the development of the autoimmune condition type 1 diabetes. As I mentioned, the signaling molecules and postbiotics created by our microbiome plays a significant role in both the gut health and hormonal health. These short-chain fatty acids can be translocated across the epithelial layer and then lead to the production of choline metabolites, which is important for brain health, tryptophan metabolism, and even the creation of neurotransmitters. I thought it would be very important to share the bacterial strains that are known to produce neurotransmitters. As you know, the majority of our serotonin is produced in the gut, and it includes a number of strains that can make serotonin, include some lactobacillus species, E. coli, Morganella, Klebsiella, and even Hafnia alvi. Dopamine can be made by a series of bacteria, including those in the Bacillus genus, including Bacillus subtilis, which is present in our spore-based probiotics. Noradrenaline can also be made by a number of bacteria, including Bacillus subtilis. Acetylcholine is mostly made by Lactobacillus plantarum, and GABA can be made by Bifidolongum 35624, which is a part of our newest product launch, ZenBiome Dual. And then in the blue, I highlighted these strains that are measured in our BiomeFX test as keystones, and that is Bifidobacterium adolescentis and Lactobacillus rhamnosus. Now, histamine can be made by a number of bacterial strains as well. And I listed this because this is important when choosing a probiotic for patients that may have histamine intolerance or suffer from mast cell activation syndrome. Before we get into insights on the microbiome and the HPA axis, I wanted to take a moment to hop in the chat and Q&A and see if you all have any questions on some of the information that we presented a few moments ago. So I'm gonna hop in the chat and see. Okay. As you have questions, feel free to drop them in the Q&A. All right, so let's chat about the gut microbiome and its relationship with the HPA axis. All right. So not only does the brain affect the gut, but the gut also affects the brain. And this action is due to the bidirectional influence of the enteric nervous system and the vagus nerve. As you know, the gut-brain axis involves a connection between our brain and our gut, and this creates a potential cyclical problem because if we are chronically stressed and have a poor diet and tend to lead a sedentary lifestyle, this will impact our microbiome, which changes our perception of stress, our food cravings, mood, and etc. And it turns into this continuous feedback loop. Now, there are a variety of host factors, such as diet, exercise, and mood and stress, that lead to alterations in hormone and neurotransmitter levels. So as we can see here, there's a number of neurotransmitters that impact bacterial growth, biofilm growth, decreased resistance to the host, increased virulence of the bacterial strains, and even decreased virulence. So the levels of neurotransmitters and hormones do play a significant role in the status of our microbiome. Stress is definitely an activator of inflammation. What we know is that psychosocial stressors activate the central nervous system, and includes activation and release of corticotropin releasing hormone right here, and ultimately activates the sympathetic nervous system pathways. So we become stressed through either early adversity in life, interpersonal conflict, or social isolation, and that triggers our pituitary gland to release corticotropin releasing hormone. That then activates our adrenal glands, which produces cortisol and increases inflammation through increasing pro-inflammatory cytokines, adhesion molecules, and so much more. There we go. Let me make sure I didn't miss one. So here's the issue with chronic cortisol expression. When we are undergoing chronic stress, we are experiencing the chronic release of cortisol. And with increased levels of cortisol, there's an increase in the permeability of the gut wall or leaky gut. And this is what helps facilitate the systemic inflammatory response. So a leaky gut essentially drives a pro-inflammatory state. And we know this because we see an increased level of circulating pro-inflammatory cytokines like TNF alpha, interferon gamma, and interleukin 6. Now, what's interesting is that interleukin 6 is known to activate the HPA axis, and over time, it also downregulates glucocorticoid receptors. Now, this plays a role into that negative feedback loop, or positive feedback loop that I discussed earlier. And so these receptors are part of that feedback mechanism. So the more you have cortisol, the more you have a leaky gut, the more your patient is experiencing inflammation and is in a pro-inflammatory state. The longer they're in that pro-inflammatory state, the fewer glucocorticoid receptors that will be available to bind cortisol, and the more cortisol that's available to be circulated throughout the body. Now, evidence suggests that these changes in the receptor expression can cause a reduction in serotonin that's made in our hippocampus in the brain. This causes a release in brain-derived neurotropic factor. And all of this increases our susceptibility to depression. Now, inflammation can also impact tryptophan metabolism, and it can drive tryptophan to either a neurotoxic or neuroprotective effect on mental wellness. So in our diet, we get tryptophan from our diet, and our diet also feeds our microbiota. And our microbiota can also make tryptophan. Now, when we have an inflammatory state, meaning that we have the presence of a lot of these pro-inflammatory cytokines, this is going to drive tryptophan into this neurotoxic pathway where kynurenine and quinolinic acid are going to be produced. When patients are driving their tryptophan into this neurotoxic pathway, they tend to present with depressed mood, irritability, a lower resistance to stress, poor sleep, and poor concentration. But when a patient has a healthy microbiome and is in a low inflammatory state, then tryptophan can be shuttled into the neuroprotective pathway, where it is turned into serotonin and melatonin and kynureninic acid. Patients with a healthy tryptophan metabolism pathway tend to have better sleep, a better circadian rhythm, a positive outlook. They feel more resilient to the stressors in their life, and they have a good working memory. It's also important to know that stress, cortisol, and overactivation of the HPA axis is known to upregulate this enzyme IDO. And IDO is the primary enzyme that turns tryptophan into kynurenine and drives it into this neurotoxic pathway. So now that we're able to understand the connection between the gut microbiome and the HPA axis, let's start talking about the gut microbiome and thyroid dysfunction. As you know, the thyroid is one of our main endocrine hormones that lies at the base of our neck. It is a target, the gut is a target organ for thyroid hormones, specifically T4 or thyroxine and triiodothyronine or T3. Thyroid hormone receptors are expressed on the surface of our intestinal epithelial cells. And in fact, intestinal epithelial development is controlled by thyroid hormone signaling. And so a disruption in the microbial composition has been associated with the development of Hashimoto's thyroiditis, Graves' disease, and Graves' orbitopathy. As you can see, thyroid hormone plays a significant role in many of our bodily functions, including our heart rate, breath rate, glucose metabolism, our menstrual cycle, bone health, body weight, and even brain development. So I wanted to connect the dots with the thyroid hormone and our gut microbiome. And that really starts with the production of an enzyme called beta-glucuronidase. And this enzyme is made by a group of bacteria called the estrobolome. And this bacteria, it makes beta-glucuronidase, which metabolizes and breaks down the dual combination of hormones and glucuronic acid that takes place in the liver during phase 2 metabolism. Now, this gut bacteria can also make sulfatases, which pulls sulfate groups from these detoxification compounds. And so the production of these enzymes, beta-glucuronidase and sulfatases, can actually reverse critical detoxification in the liver. And this results in not only recycling hormones like estrogen, but also recycling T4 and T3. Now, this is important because I'm sure many of you who manage thyroid disease knows that finding the right dosing of thyroid hormone for your patient can be very tricky. It can take some time to find a stable dose that reduces their symptoms. And so if you're working with a patient that also has gut dysbiosis, having a recycling of these thyroid hormones can make it even more difficult to find a stable thyroid dose. Another connection between thyroid hormone and the gut is the activity of intestinal alkaline phosphatase. Now, this enzyme is a brush border enzyme and is primarily expressed in the small intestine in the duodenum. Now, intestinal alkaline phosphatase is important because it dephosphorylates or deactivates LPS or lipopolysaccharide. You'll remember that lipopolysaccharide is a bacterial endotoxin. So when LPS is dephosphorylated, it can no longer cross the gut barrier and enter circulation. And so as you can imagine, this is a pretty important enzyme to have in your gut. Well, the gene that helps make this enzyme, IAP, is T3 responsive, which directly links its expression to thyroid hormone levels. So if you have a patient who has hypothyroidism, they're likely to make less intestinal alkaline phosphatase, which means their gut is less able to dephosphorylate or deactivate LPS. So even more LPS is being leaked into circulation and causing systemic inflammation. In animal models, researchers discovered that decreased IAP gene transcription in hypothyroid rats actually made them more susceptible to LPS toxicity. And this finding was also seen in zebrafish. So this really shows the impact of having healthy thyroid hormone levels, making sure that your patients have a stable thyroid dosing so that we can have more intestinal alkaline phosphatase and do a better job of detoxifying LPS. So here are some microbial patterns in autoimmune thyroid disease. Now, here's a list of bacterial strains that are associated with decreased expression of the antibodies, the TPO antibodies, and the thyroid receptor antibodies. Bacteroidetes, the Dorea species, and one of our favorite keystone species, Faecalibacterium prausnitzii. Then we have bacterial strains that are associated with increased expression of TPO antibodies and thyroid receptor antibodies. Now, what we know in the research is that this is likely due to molecular mimicry. So the structure and surfaces of these bacteria do share molecular similarities in these antibodies. So that's the Blausch's species, some species of Lactobacillus, the Allistites species, and even Ruminococcus. And then bacterial strains that are more often seen in patients with Hashimoto's thyroiditis include Lachnoclostridium, Bilophilo-Wadsworthia, which is a very common pathogen detected on our BiomeFX stool test. It is a sulfate-reducing bacteria that actually is resistant to bile. And then also Klebsiella pneumoniae has been associated with patients with Hashimoto's disease. So let's move on to the connection between the gut microbiome and glucose regulation. Okay. So here, let's talk about the major glucose balancing hormones in the GI tract. First, let's start with GLP-1. Glucose-like protein 1 is an incretin, and it has the ability to lower blood sugar levels in a glucose-dependent manner. And it does this by enhancing the secretion of insulin. The action of GLP-1 is preserved in patients with type 2 diabetes. But in addition, GLP-1 also ensures that B-cell insulin stores are replenished, and that is ideal to help resolve and prevent exhaustion during the secretion. And it does so by increasing the production of insulin. GLP-1 also increases beta cell mass and promotes proliferation and actually inhibits apoptosis of B cells. So it really strengthens the B cells in the pancreas. It strengthens insulin production to help keep blood sugar levels as balanced as possible. And then we have leptin, which is a hormone that's released from our fat cells. And it signals to the hypothalamus and helps us adjust our food intake. So it alters food intake and helps control our energy expenditure over the long term. What's interesting is that obese people tend to have unusually high levels of leptin because they have more adipose tissue. And so oftentimes in patients who are obese, their brain does not respond to the leptin, and so they keep eating despite adequate or even excessive fat stores. And this is a concept we know as leptin resistance. Then we have ghrelin. Ghrelin is our hormone that's produced and released mainly by the stomach, and small amounts can be released in the small intestine, pancreas, and brain. Ghrelin has a number of functions, and it is termed our hunger hormone. And that's because it stimulates our appetite and increases our food intake and promotes fat storage. In addition to increasing appetite, ghrelin plays a key role in mediating whole body glucose and energy homeostasis. Now, in the pancreas, ghrelin stimulates the release of glucagon, and that's our storage form of glucose, and helps us and stimulates the release of glucose from the liver and the fat tissue, and it goes straight into our bloodstream. And it's also suggested that ghrelin actually suppresses insulin secretion from the pancreas in order to reduce glucose storage in certain organs. Lastly, we are going to discuss insulin. Insulin is produced by our beta cells in the pancreas, and it is critical for optimal glucose regulation and balance. Now, without glucose, our cells are not able to use without insulin, our cells are unable to use glucose as fuel and instead stores it as fat in order to be used for energy down the road, especially when glucose levels are too low. Now, what's interesting is that leptin actually has a more profound effect when we lose weight. And that's because when we lose weight, the level of leptin falls. And this actually stimulates a huge appetite and an increase for food intake. And so the hormone that actually helps us maintain our normal weight. And so unfortunately for dieters, that makes it even harder to lose weight and lose those extra pounds. Type 2 diabetics. Research has shown that type 2 diabetics are more likely to have gut dysbiosis. So the gut microbiome not only helps us regulate our hunger and satiety hormones, but it can also impact insulin release and insulin sensitivity. There have been a number of studies that have highlighted the connection between the gut microbiota and glucose regulation. Specifically, the species Lactobacillus fermentum, Lactobacillus plantarum, L-casei, Roseburia, Akkermansia, and B. fragilis have all been shown to improve glucose metabolism and insulin sensitivity. And they've also been shown to suppress pro-inflammatory cytokines. And I wanted to talk a moment about metformin. Metformin is a first-line pharmacotherapy for type 2 diabetes. It's been shown to actually act primarily in the gut and alters the composition of the gut microbiota. Metformin has been shown to increase butyrate production, to increase propionate production, and has also been shown to increase levels of Akkermansia eosinophila, which is one of our top keystone species that has a key role in stabilizing the gut mucosa. Let's talk a little bit more about metformin. At the phylum level, what we saw is, in this study, we saw a relationship between the gut microbiome and metformin. And at the phylum level, patients that were treated with metformin and had type 2 diabetes actually had firmicutes, an abundance of firmicutes, and that actually was lower. The abundance of firmicutes in the type 2 diabetes patients was lower than what we saw in the control group. In addition, we saw that proteobacteria was actually more abundant in the type 2 diabetes group compared to the control group. And this is very important because the proteobacteria group is where we find that type of bacteria that contains LPS, or lipopolysaccharide, which is the driver of leaky gut and systemic inflammation. What we also saw is that Roseburia, which is a primary butyrate producer, was less abundant in type 2 diabetes. Now, the abundance of gram-negative bacteria is important because the presence of gram-negative bacteria can stimulate the immune system. And in fact, it activates toll-like receptors, which activates the pro-inflammatory cytokine pathway. And so this study really highlighted the changes that happens in the gut microbiome with patients that have type 2 diabetes, even when they are treated with metformin. Type 2 diabetes patients often have a low alpha diversity as well. Now, the gut microbiome and reproductive hormones. Let's take a look and study how the gut microbiome impacts women's health and even fertility. So as we talked about previously in the thyroid section, we talked about the gut microbiome and beta-glucuronidase. Beta-glucuronidase does impact thyroid hormone, but also estrogen metabolism. So in a healthy microbiome, we have a woman with a balanced ovary activity. Estrogen acts in the ovaries, in the body. It goes through the liver and the gut. And so in a healthy woman, most of the estrogen exits the body. The liver packages it up and is able to pass through the gut and is excreted in stool. Now, some estrogen does go back into the body, and that's great for balancing estrogen levels. Now, in an unhealthy dysbiotic microbiome, this patient, while the liver will do its best to package up any excess estrogen and prepare it for excretion in the body, their gut microbiome has a lot of bacteria in that estrobolome group. And so they make quite a bit of beta-glucuronidase. So in a woman with an unhealthy microbiome, only some of the estrogen is able to exit the body, but most of it goes back into the body and reactivates the estrogen receptors. This plays a key role in women dealing with fertility issues, struggling with perimenopause and menopause, and a host of other conditions. So here are the chemical structures of estradiol and estrone, the two primary forms of estrogen. Once they have activated the estrogen receptors, they are sent to the liver, where they are packaged and partnered with glucuronic acid in the liver. So you can see here, this is the glucuronic acid tag, and I like to consider glucuronic acid as estrogen's chauffeur. So in the gut, in a dysbiotic gut, then we have bacteria that makes beta-glucuronidase, and it essentially cuts that connection from glucuronic acid and estradiol. Now estradiol and estrone are able to go back into circulation and reactivate receptors. This can lead to breast cancer, endometrial hyperplasia, endometriosis, ovarian cancer, and even polycystic ovary syndrome. Here are a list of bacteria that we know that can secrete beta-glucuronidase. The Clostridium family, Proteobacteria phylum, E. coli, Salmonella, Pseudomonas, Bacteroides, Shigella, and even Streptococcus. There's also evidence that there's dysbiosis, and it plays a role in women with endometriosis. As you may know, endometriosis is an inflammatory estrogen-dependent disease that's defined by the presence of endometrial tissue outside the uterine cavity. Endometriosis affects approximately 6 to 10% of reproductive women and is a significant cause of morbidity for young women. This study here showed a significantly higher alpha and beta diversity in the control group compared to endometriosis. So women with endometriosis tend to have fewer bacteria in their microbiome, and the quality of their microbiome is decreased as well. One of the primary causes of estrogen dysfunction and endocrine disruption as it pertains to reproductive hormones is the presence of endocrine disruptors. So endocrine disruptors, much like bisphenol A and other xenoestrogens, can induce a dysbiotic gut microbiota. So this leads to dysregulation of intestinal permeability, so making your patient more susceptible to developing leaky gut. This allows antigens and endotoxins to leak into circulation and cause inflammation. In men and women, this can present differently. So in men, we generally see an altered metabolism of their androgens and testosterone and DHT. They will also have a compromised blood-testes barrier and impaired sperm quality and quantity, which is very important as it pertains to family planning and fertility. With women, we'll see altered estrogen metabolism. Oftentimes, some women will present with premature ovarian failure, polycystic ovary syndrome, and endometriosis. Gut dysbiosis not only impacts fertility, but it can impact the maternal connection with the fetus and impact pregnancy and postnatal period. Dysbiosis can impact the placental environment, and it also, the mode of delivery, breastfeeding, and antibiotics can also impact the fetus gut microbiome as well. It impacts parental genetics, the environment, and even maternal stress and parental microbiota can impact the fetal microbiome as well. And then, of course, let's talk about dysbiosis as it pertains to male infertility. Researchers have found that E. coli is one of the most common pathogens that has a negative effect on male infertility. Studies have provided evidence that indicates that an E. coli infection has detrimental effect on male fertility, and it reduces sperm motility, vitality, and even changes sperm morphology. Now, as far as known, the detrimental effect of E. coli on sperm could be associated with a variety of factors, including E. coli's ability to adhere to sperm and modify its expression of hemolysin A, which is a virulence factor involved in premature acrosomal activation and sperm nuclear DNA damage. So these are all steps that lead to damaging the sperm, which can impact fertility and lead to male factor infertility. And lastly, it has been proven that the sperm concentration and motility was significantly decreased in a mice model that were fed a high-fat diet and had a decreased abundance of certain groups of bacteria, including Bacteroides and Microbiome, which is where we find Akkermansia eosinophila. So now that we have discussed the connection between the gut microbiome and the HPA axis, the thyroid, glucose regulation, and reproductive hormones, let's take a look at a case study that I've created for you. Feel free to hop in the chat to answer some of the questions and we can work through this together. So we have a 40-year-old patient, a female patient that presents to clinic with a history of hypothyroidism, IBS, and depression. You've made great progress with your current treatment plan, but you would like to see more improvement in some of her symptoms. So you've decided to run a Biome stool test to get a better understanding of her gut health. So let's take a look at some of the results that you got back. This patient has low alpha diversity and low beta diversity. They also have a high firmicutes to Bacteroides ratio. Remember, when comparing the different phyla present in the gut microbiome, we prefer to see mostly Bacteroides here in this green, followed by firmicutes. And so this patient actually has it in reverse. And this is something that we'll need to improve on. This patient also has high pathogens. She presented with a low pathogen control index score and has C. diff, E. coli, Klebsiella, and Bacteroides fragilis present in her microbiome. When we look at the functions, she also has elevated ammonia and H2S, or hydrogen sulfide gas. And then also she presents with elevated beta glucuronidase, which you remember recycles estrogen and prevents the liver fully detoxifying estrogen from the body. So before I walk you through the products that I would use, the Microbiome Labs products that I'd use to help this patient, let's go in the chat and what are some of our products that you would want to use to help support this patient? Let's see what we have. Okay. Anyone have any ideas, any recommendations? I wish I had some Jeopardy music, honestly. All right, we'll give it a few more minutes and then I'll walk you through my treatment plan. Okay, Sarah Hill, you would use Megaspore and Mega IgG. Absolutely. Megaspore is going to help rebalance the gut, and Mega IgG serves as our binder. Mega Pre, wonderful. Yes. Anyone else? Let's get a couple more suggestions and then I'll walk you through my plan. So far, we have Megaspore, Mega IgG, and Mega Pre. All right. Great. Thank you, everyone. Let's check in and see what the plan is. Now, starting off, we are going to start with our total gut restoration system. As I'm sure you all know, TGR is our advanced 3-month protocol that is able to support and restore gut health. It's a combination of Megaspore Biotic, Mega Pre, and Mega Mucosa. This entire system focuses on reconditioning the gut, reinforcing those changes, and rebuilding the mucosal layer. The first step involves competitive exclusion through our spore-based probiotics. We use Megaspore Biotic at this stage, and it is designed to increase those keystone species, which we saw plays a huge role in the development of thyroid disease and diabetes. It also helps increase diversity because, as we've seen, a number of these endocrine conditions are associated with both low alpha, which refers to the quantity of bacteria, and low beta, or the quality diversity in the gut. The next stage, we will reinforce those changes that we saw with Megaspore with Mega Pre, our precision prebiotic. Now, this step is going to affirm this new microbiome that we created. It'll help us establish higher and more stable populations of beneficial bacteria and increase key short-chain fatty acids, which we saw is very important as it pertains especially to glucose regulation. And then lastly, we are going to finish with rebuilding the intestinal mucosa. Now, this allows for rebuilding of the mucosa now that we have changed the landscape and ecosystem of the microbiome and are feeding it well with the Mega Pre. This reduces mucosal and intestinal inflammation and modulates mucosal immune responses and provides mucosal building blocks. Give me 1 second, please. All right. So as I mentioned, this includes Megaspore, Mega Pre, and Mega Mucosa. Okay, so we've started talking about the total gut restoration. That's the first step that I would do. Next, we are going to introduce Mega IgG 2000, which, remember, is our binder. So it's going to bind and eliminate toxins. It can bind LPS, C. diff toxins, and even H. pylori. It is stronger than colostrum. So our Mega IgG 2000 contains 45% of IgG immunoglobulins compared to only 25% in colostrum. And it strengthens immune tolerance. It neutralizes LPS, which is important, especially if you have a patient with hypothyroidism who may naturally make less of that intestinal alkaline phosphatase enzyme. So this helps get rid of the LPS as we're working to restore their gut health and hormonal health. Next, we will work with Mega Marine. Megamarine is our gut-specific fish oil that is full spectrum and formulated to support a healthy gut microbiome. It has a superior ratio of EPA to DHA and also features the forgotten fatty acid DPA. The arachidonic acid to EPA ratio is something to consider when choosing your fish oil. So this ratio is a biomarker of cellular inflammation in the body. And so higher ratios of this is associated with colon cancer, breast cancer, insulin resistance, depression, and even heart disease like acute coronary syndrome. And so omega-3 supplementation was shown to actually reduce this ratio by 40% in 8 weeks. And so this is a wonderful addition to add into this patient's protocol because it's going to help reduce inflammation, which is inherently going to improve her symptoms and also help support the balancing of the gut microbiome and hormonal dysregulation. And then lastly, to manage her IBS complaints, we are going to provide ZenBiome Dual. ZenBiome Dual is our newest product. It's a dual strain probiotic approach to digestive discomfort, and mood self-regulation. It features 2 clinically studied strains of Bifidobacterium. It features Bifidobacterium longum 35624 and Bifidolongum 1714, which is present in our other 2 ZenBiome products. So 35624 and 1714 have been found to significantly improve IBS symptoms. Over the course of 8 weeks, 40 women with IBS and mild to moderate anxiety and or depression were provided this ZenBiome Dual product. What we found is that there was a reduction in a number of IBS symptoms, including abdominal pain, abdominal frequency of that pain, bowel habit satisfaction, quality of life, and even overall IBS symptoms. We also saw an improvement in their depression and anxiety scores, as well as sleep quality. And we also measured the inflammatory biomarkers. Now, with the inflammatory biomarkers, we measured cortisol and was able to find a normalization of cortisol in those patients. And we also saw improvements in TNF alpha, IL-6, and even C-reactive protein levels. So in summary, the composition and diversity of our gut microbiome plays a critical role in the regulation of the endocrine system. An overabundance of inflammatory bacteria can actually upregulate inflammatory cascades and exacerbate endocrine dysregulation. Optimizing the gut microbiome by increasing diversity, short-chain fatty acid production, and immune tolerance can support healthy endocrine function for your patients. Now, this coupon code I actually have to change. Trent will actually post the correct coupon code. So when you get the slides, the correct one will be there. But Trent will come on later to discuss the coupon code details. In the slides, I've also provided a list of my references for your review and your information. And thank you so much for your attention.
Outstanding. Thank you so much, Sarah. That was very impressive. Really appreciate that. And as you mentioned, we will certainly be sharing with all guests today that are live. And thank you very much for showing up live. And for those watching in your own time, thank you very much for tuning in. So we'll be sending out the replay of today's message, also a very special discount code with more information to be able to secure those extra savings, along with the slide deck of Dr. Ellis's presentation today. So as Sarah mentioned, we have recently launched the groundbreaking new product in ZenBiome Dual, and tomorrow we're actually launching another new product, which is the enzymatic mouth fresheners in a 12-pack pre-pack, which I'm sure you'll be very interested in. And again, for the remainder of this month, we also do have a 20% discount on BiomeFX available as well. So please feel free to reach out and schedule a time to meet up with your Microbiome Labs account manager for further support over the days ahead. So again, love to take the opportunity to thank each and every one of you for taking part in today's webinar, and hoping that you're all enjoying the clinical webinars that we provide on a monthly basis, and we're looking forward to continuing that support over the days ahead. So thank you very much for what you're doing with your patients and your clients on a daily basis, and we do value and appreciate each and every one of you out there. So look forward to talking more over the coming days. Thank you very much.